Question, did you know that adrenal fatigue can cause a host of health problems? And you may have it without even knowing it. Dr. Stephen Hotze is the founder of the Hotze Health and Wellness Center, and he's here to talk about natural bioidentical hormones. Good morning to you.
Good morning, Brenda.
I was in the elevator the other day, and I saw something flash on the screen. You know, some of those elevators in these big buildings have that little screen in there, and it talked about just this, adrenal fatigue and cortisol.
That's interesting.
Yeah, it was very interesting. So let's talk about the symptoms of adrenal fatigue.
Adrenal classic feature is chronic fatigue, tiredness, joint and muscle aches and pains, recurring chronic infections, anxiety, depression, low blood sugar, an inability to really bounce back from stressful situations, infertility, irregular menstrual cycles, a host of problems that are associated with other hormonal declines.
So what's the cause of this?
It's caused by two things. One is caused by the aging process. As we age, our adrenal glands, which sit on top of the kidneys and about the size of a walnut, make less and less adrenal hormones. The second thing that causes it is chronic unrelenting stress, whether it's physical or psychological. And this can be from, for instance, in women, it can be from, driving the kids to school, driving back and forth to work, having a job, having to raise kids, having to raise a husband. All the,
you said what every woman thinks.
That's stressful, okay? It's, the longer you're married, the more stress you've got. The per hour
So
drink.
my husband is making me sick.
Chronic fatigue. You go, well, it's just the stress. And the adrenal glands, it's kind of like lifting weights. You can pump weights and and all of a sudden after you 10 or 12, the muscles become fatigued. Chronic stress, whether it's physical from chronic pain, chronic allergies, asthma, recurrent infections, all these things wear and tear on our immune system and wear and tear on the adrenal glands, and our body makes less and less cortisol.
I would imagine that most people who are suffering with this don't know it.
They don't know it.
So how is this manifested in them, and what should they be looking at?
Well, you notice it has very much the same symptoms that hypothyroidism has. And that's because the hormones work together synergistically. Hypothyroidism, of course, causes the fatigue, the hair loss, the weight gain, the inability to think clearly, the depression, the poor sleep habits.
And you just can't recall words, and just simple things.
But cortisol interacts with the thyroid and enhances its ability to be utilized properly. So as your adrenal glands make less cortisol, your body is less able to utilize thyroid hormone.
That's not a steroid, though, is it?
It is. It's your natural steroid. Our body makes natural steroids. Cortisol is a natural occurring steroid, as is estrogen, as progesterone, testosterone. These are natural hormones that our body makes.
But we've been made to feel nervous about steroids.
Well, steroids, when they're made by drug companies and that are counterfeit and that aren't molecularly the same as the hormones in our body, are very dangerous because they have hyper effects. Those are the things we're concerned about. And even your natural occurring hormones, if you don't have enough of them, you can be sick. If you took too much of them, you could be sick. So there's a physiological range and a balance, and that's what we recommend is keep, as you age and your hormone levels decline, whether it's the adrenal hormones or your female or male hormones or your thyroid hormones, simply replenish them, fill up the tank.
But you need to replenish it with the right type of. It needs to be bioidentical.
And by bioidentical, we mean molecularly the same as the hormones that your body made before, so they're biologically the same.
So let's talk about synthetics then.
Well, the synthetics look like, in a way, they're similar to the bioidentical hormones, but they have chemical changes that the drug companies have placed on these hormones so they can patent the hormones, so they can sell them under a proprietary label. But when you change a hormone, it causes a significant difference. The difference between a man and a woman, between you and me, is a hydrogen ion on the molecule. One hydrogen ion makes you a woman, and having a double bond on oxygen on this particular steroid hormone in our body makes me a man. One little change can make huge differences. So if we're going to put hormones in our body, they ought to be the same identical hormones that God put in our body to begin with.
That's right. All right. Thank you so much, Dr. Hotze. All right. If you would like more information on this subject about adrenal fatigue, you can just go to our website or to Dr. Hotze's website. It's HotzeHWC.com. Hotze with a Z, HWC.com. There's also a phone number. It's 877-698-8698. Now,